Good afternoon, everyone. My name is Dr. Mohammed Abba-Aji. I'm a research fellow here at the school, and I also have the privilege of working and learning under Dean Sandro Galea as his mentee in the DRPH program. So today I'm excited to share our work, which takes a population health approach, as Dr. Abdullah has mentioned. And then building on Dr. Abdullah's earlier introduction, I would highlight four projects our team has been engaged in within the last year. So the first project is we wanted to understand, we wanted to situate ourselves in the literature of gun violence. So what we did was we did a systematic review where we looked at thousands of papers, and we came up with 30 papers that looked at these mental health outcomes, or at least mental health outcomes in general, where we found that majority of the papers mainly looked at depression, followed by PTSD, anxiety, and substance use. For the outcomes, we can see this, the orange bars reflect positive associations between exposure to gun violence and the outcome, while the green bar shows a reverse association. That means exposure to gun violence reducing the risk of the outcome. So we can see from the from the bar above, so only substance use was reduced in one of the studies due to exposure from gun violence. This was also a cross-sectional study, so we would be very, very cautious in our interpretations of that. Well, secondly, we looked at the community impact of gun violence. Like Dr. Abdullah said, our team is interested in population health impacts of causes generally, and in this case, gun violence, where we see that there is an increased burden of depression. We assessed major depressive episodes within the last year in these communities since the mass shooting and within the past month. You can see across board all of these sites we assessed depression in had a burden that was higher than the national average. The one at the extreme right is the overall burden. That means that a meta-analysis of the prevalence of depression across the 6 communities we looked at. Well, we also wanted to assess the long-term impacts of gun violence. We're privileged to have data, like Dr. Abdullah said, of direct victims. Particularly, we had data from victims of the Las Vegas massacre, which was the deadliest in the US history. And not surprisingly, we saw a high burden of major depressive episode and PTSD among victims. But what's even more concerning was that this was even 5 years after the mass shooting. And then unsurprisingly as well is severe exposure to the mass shooting and low social support were associated with greater risks for both major depressive episodes and PTSD. So lastly, I would just, I think this is something that really touches Dean Galea a lot, which is a population health approach to to gun violence has to take cognizance of the ubiquity of the cause, which in this case, the important vector is guns themselves in the US, like Dr. Abdullah has highlighted earlier. So we wanted to examine specific behaviors, specifically what were the gun purchasing behaviors in communities that were affected by mass shootings. This is especially important in these communities because of the now popular notion of the spiral of doom, where it's proposed, or at least there is a hypothesis that communities that experience mass shootings also have higher gun purchases, and there are empirical studies about that as well. So here we conducted a generalized structural equation model, and we controlled for various factors like demographics and regional variations to assess the probability of either 1, purchasing or owning a firearm, or 2, intending to purchase a firearm, or 3, falling in the last category, which is neither of the 2. So our model revealed, as you can see here, that about almost 20% of the population reported that they had already purchased a firearm, and then another 25% intended to purchase a firearm, and while 56% did not own and had no plans. Now, when it comes to what motivates these decisions, the fear of general crime significantly increased the likelihood of either purchasing firearms or intending to purchase them. However, surprisingly, the fear of mass shooting was actually associated with a decreased likelihood or decreased probability of owning a firearm, and it also had no relationship or significant relationship with intentions to purchase a firearm. So through this study, we were able to show that decision to buy firearms in the wake of mass shooting is a very, very complex one, and it's influenced by various factors. So it's therefore important we discuss policies and interventions aimed at breaking this cycle while considering this context as well. Thank you very much.